As we mentioned before the break, researchers found the Massachusetts health care reform law, on which the Affordable Care Act was modeled, has likely saved lives at the rate of 1 life a year for every 830 adults who gain insurance coverage. Joining us now from Boston is one of the authors of that study, Dr. Ben Summers, a primary care physician and assistant professor of health policy and economics at the Harvard School of Public Health. Nice to have you, Dr. Summers.
Thanks so much for having me.
All right, so tell me a little bit about the results. You found in this case that certain communities actually benefited disproportionately from the health care law. Who lives in those communities?
Right. So when we saw this decline in the death rates in Massachusetts, and we wanted to be sure, is this really about health reform? And one of the ways to do that is to look at the pattern of where these changes in mortality happened. And the biggest declines in the death rates were in areas that had more poverty, lower income, more people who were uninsured before the reform took effect. And we also saw larger gains for racial and ethnic minorities, all of which is consistent with what you might expect if the driving factor behind these changes in death rates was increased access to care and health coverage.
So typically when we talk about a disproportionate impact of a public policy on communities of color and poor communities, we almost always are talking about a disproportionately negative impact. And so in this case, it was surprising to read that there was a disproportionately positive impact. Is it enough to close what we think of as kind of the racial health gap? And I know there are many racial health gaps, but life expectancy is among them.
Right. When you take into account age, we know that the death rates are higher for non-whites and for Latinos compared to whites. And what we find in our study is that the relative reductions in death rates in those minority communities went down by roughly twice as much as they went down among whites after Massachusetts health reform. But as you said, there are actually a lot of factors that seem to drive these health disparities, and these reductions, while significant, don't explain the majority of the overall disparity, which suggests that there are a lot of other factors that still need to be addressed before we can really fix some of these fundamental inequities in health in our society.
All right, so Avik, I want you to kind of put the piece that you put on the table earlier, which is this idea that maybe Medicaid, just sort of having that card, doesn't have this increased impact or improved impact on health that we might like to see in relationship with what we now know about Romneycare's success,
right,
and with what Dr. Maybank was saying here, that it may be just one part of a larger story.
Right, so it's a great question. And I did this analysis for Forbes when I wrote up Dr. Summers' study. About 88% of the people who gained coverage under Romneycare gained it through private insurance, either the exchanges or through employer-sponsored coverage. So Obamacare relies much more on the Medicaid expansion piece of it. And of course, the state of the health insurance system in Massachusetts was fairly different than the state of the health insurance system around the country. So for those reasons, we have to be cautious about extrapolating the results from the Romneycare effect to that for Obamacare generally. But I think what we can glean from this study is that expanding private coverage, private insurance coverage, does improve health outcomes, and that's consistent with the literature that we've had. In most of the studies that compare the performance of private insurance to Medicaid, private insurance does improve health outcomes substantially relative to Medicaid.
So, Dr.